Welcome back to the Medical English Pro, the place where future doctors, nurses, and healthcare professionals polish their English to exam-ready perfection. In medicine, the wrong verb can destroy the clarity of a diagnosis. So today, you're getting a masterclass on Diagnostic Collocations, the exact phrases examiners expect because they show accuracy, efficiency, and professionalism. We'll compare them, analyze synonyms, break down subtle differences, show them in real-life hospital context, and practice how to use them in exam speaking and writing tasks. Section 1. Diagnosis Verb Collocations. Make a diagnosis versus establish a diagnosis versus arrive at a diagnosis. These three are similar but not identical. Make a diagnosis. Most common, used in everyday clinical conversation, general and neutral. Examples: the physician made a diagnosis of acute pancreatitis, or it took several hours to make a diagnosis. Exam use: good for role plays and writing tasks, natural in OET speaking. Establish a diagnosis. More formal, used in academic writing, research, and multidisciplinary discussions. Suggests accuracy and evidence. Examples: imaging was required to establish the diagnosis. Or, further testing is needed to establish a definitive diagnosis. Exam use: excellent in B2 writing tasks, shows strong academic register. Arrive at a diagnosis. Emphasizes the diagnostic process, implies gradual reasoning. Used in case discussions. Examples: the team arrived at a diagnosis after reviewing the MRI. Or, we finally arrived at a diagnosis of Lyme disease. Exam use: good for describing complex cases, perfect in a case report summary. Differences made simple. Make equals everyday, neutral. Establish equals formal, precise. Arrive at equals reasoning, process-focused. Section 2. Rule out family. Rule out a condition, meaning check if disease is not present. Examples: we need to rule out pulmonary embolism. Or, an X-ray was ordered to rule out a fracture. Context: ER, urgent care, differential diagnosis discussions. Exclude a condition. More formal, common in documentation, exams, and research. Examples: malignancy cannot be excluded based on this scan. Or, further tests are necessary to exclude infectious causes. Screen for versus rule out. These two often confuse B2 learners. Screen for equals check healthy people for early signs. Examples: patients over 50 should be screened for colon cancer. Rule out equals check symptomatic patients to confirm absence. Section 3. Testing and results collocations. Run a test. Informal clinical, very common in spoken English. Example: let's run a complete blood panel. Perform, conduct tests. More formal, used in writing. Examples: the lab performed a culture. Or, researchers conducted a series of diagnostic tests. Results collocations. Show, simple, neutral. The X-ray showed no abnormalities. Reveal, stronger, indicates discovery. The CT scan revealed a large mass. Indicate suggests or implies a diagnosis. The symptoms indicate possible appendicitis. Confirm. Final, definite, no doubt. The biopsy confirmed the diagnosis of lymphoma. Comparison round. Show equals basic information. Reveal equals uncover something hidden. Indicate equals point towards a diagnosis. Confirm equals 100% certainty. Section 4. Patient presentation and workup. Present with versus presenting complaint. Present with describes symptoms. The patient presented with nausea and fever. Presenting complaint is the main symptom recorded. The presenting complaint was chest pain. Take a history versus obtain a history versus elicit a history. Take a history, standard clinical phrase, most common. I will take her medical history now. Obtain a history, more formal. We were unable to obtain a history due to confusion. Elicit a history suggests careful questioning. It was difficult to elicit a clear history. Examination verbs: perform an examination, carry out an examination, complete an examination, undergo an examination, patient. Examples: the doctor performed a neurological exam, or the patient underwent a CT scan. Section 5. Complex diagnostic phrases, B2+. These are gold for exams. Differential diagnosis. The differential diagnosis includes influenza, COVID-19, and pneumonia. Working diagnosis. The working diagnosis is sepsis. Provisional diagnosis. A provisional diagnosis of meningitis was made. Clinical suspicion. There is a strong clinical suspicion of pulmonary embolism. Difference: working diagnosis equals what we think it is. Provisional diagnosis equals temporary but documented. Differential diagnosis equals list of possibilities. Section 6. Final multiple choice test. 1. The team conducted several investigations, but they still couldn't make, reveal, or rule out a clear diagnosis. 2. A CT scan was ordered to screen for, rule out, or establish any signs of internal bleeding. 3. The patient presented, arrived with, or appeared with a severe headache and stiff neck. 4. The laboratory will run, show, or respond to a blood culture to check for infection. 5. The MRI indicated, obtained, or took a small mass near the pancreas. 6. Before surgery, the doctor must take, obtain, or elicit informed consent. 7. The patient did not present, monitor, or respond well to the initial antibiotic treatment. 8. The differential, working, or presenting diagnosis included pneumonia, asthma, and heart failure. If you scored 7 or higher, you are absolutely exam ready. If not, watch the video again, practice these collocations every day, and you'll master them quickly. If you enjoyed this masterclass, hit like, subscribe, and comment which medical topic you want next. Follow for more Medical English Pro.